Well, I just want to give an update on how I'm looking. It's looking a little better. Dr. Yamini did what he could. He said he could not do the eyebrows. So that may be something I'm stuck with. I haven't given up on trying to find someone, but everyone says that they can't. But at least we have this part up for now. And I don't know if it's symmetrical yet, but I'm pretty sure it is. But I do know from what has transpired this go around is that Dr. Yamini did it the right way. He made sure I did the blood panel. He checked my clotting time to make sure that I could clot and wouldn't bleed. And he also put drains. Let me see if I can turn this around here. How do I turn it around? I'm not sure how to do that. The drains. These are the drains. Let's see. These are drains, and they are attached to me, and they go all the way up. So I'll take a photo of just the drains, but yeah, these are the drains. I guess that's a better view. You know, they roughly did the surgery at the same time of day, you know, just 4 and more than a half years later. But this is what had pooled up in my neck, this amount of fluid. And apparently that's normal. And had he done proper due diligence, he would have put drains in to make sure that whatever pooled didn't go into my chest, didn't go into my neck, didn't go into my face. You know, we're at the time of day where I went back to Dr. Alessi because all this had pooled in my body instead of in a drain. So this is the correct way, and to do blood work and echocardiogram, physical, he never did any of those things. He just skipped steps. And as for the hair, the incisions that were in my hair when Alessi did it, this guy didn't do it. But what they all noted was that the little segments that should have been there first were never placed. So that's why it didn't hold. If he had put the segments to attach, it wouldn't have just dragged through my muscle and come down. It would have held. So the problem is incompetence is really what it is. And to say that it's my fault because I got a hematoma and that's normal, no, it's not normal. You put drains to mitigate. And excessive bleeding from my head, well, if it didn't tear through the muscle pulling down, if you had put that segment, then we wouldn't have had that issue. If you had put them properly with the little segments, and I have that video that I sent you, there is a little piece in the other video that you'll clearly see that shows a endoscopic facelift, or a brow lift, sorry, that attaches to a piece and it holds. Like I said, cutting corners and cutting costs and thinking you're doing somebody a wonderful thing by cutting corners, you're not. You're not doing anything wonderful for them. I've paid dearly for almost 5 years, and I had to do this all again. And I had a proper anesthesiologist. He just did everything right. And they all kept saying the most important thing was the doing the pre-doctor visit with a doctor and doing the lab works. And if Dr. Alessi wanted to do that himself, he could have. He didn't have to send it to a primary. He's a doctor. He could have ordered the blood work. He could have checked the PT time and the INR and the PTT time. He could have checked all of that, but he didn't bother. When he discussed having a flatter stomach for me, I said, I can't. I have what do you call it, a very enlarged fibroid there, and it's never going to go flat. Well, he sent me to someone to x-ray it to see if I was lying, because I said, I can't do that because it's never going to be flat anyways. So he sent me to someone else to do that. That's in the records. But yeah, he was more concerned with more procedures, not doing due diligence. If he can send me to get my fibroid checked out, he can certainly send me to a lab like LabCorp, or even the emergency room does lab work within an hour. He would have known that I didn't have the right clotting factors that day for whatever reason. And for this particular, they asked me what I did that day. And I said, well, I had been taking, what do you call it, omegas, because they're very healthy. Maybe that did it. They weren't sure what turned my clotting time to something that should not have been operated on. It's still a mystery, and we don't really know because he didn't do due diligence to find out what my labs were. We don't know. We can only guess. So this is not my error. This man did not do the right things, and I'm having to go through all this pain and suffering. Luckily, I'm on serious painkillers right now, so I can even smile at you. But the reality is, this is a big deal at 55 years old, And look at my eyebrows. They're still not right, They're not right at all. And the man didn't do it. And his colleagues wouldn't touch it either. And, that's not nice. And it's all because he didn't put that little piece in there. He cut a corner. He cut 2 corners. He didn't do my lab works and physical. He cut corners. That's why he's a crappy surgeon. It's not his technique. At least I don't think it is. It's cutting corners. It's laziness. It's negligence. And for that, I want whatever his insurance is. I want the whole policy, because no jury would think, oh, and then he used dirty tools. When I did bleed out, because he didn't know the clotting time, he decided to grab dirty tools because he couldn't be bothered to properly clean them earlier that day. Couldn't be bothered. He had a chance to clean them when I wasn't there. I had been there 3 times that day. The first time, I went home looking really great. Stuck out my tongue even in the car. I looked okay in that picture. It had held. By the second time, it was loosening on my head. It was loosening up and traveling down through the muscle. By the third time, it had completely gone through the muscle. So he had plenty of time to clean those tools. After the first visit, after the second visit, he had plenty of time. He didn't need to use dirty tools. I mean, I've had so many AIDS tests, you can't even imagine. I think my doctor had me do them every 3 months to make sure that I didn't have hepatitis, or I didn't have AIDS, or I didn't have HIV, or I didn't have herpes. And it's not right to do that to somebody. That's 101. Make sure it's clean. Make sure it's sterile. I mean, yeah, they're rinsed off, so they're technically cleaner because he rinsed them, but they didn't go through the autoclave. All these germs can't be rinsed off. They'll survive, and they'll infect you with a rinse off. So I think I've explained as much as I can. I don't know what else I can tell you, but this man is negligent, not just to me, but to others. And clearly he's a narcissist, because a decent man would have apologized. He would have had his insurance pay out, and this would have been fixed years ago. And I wouldn't have had to live like this. So, I don't know. We're just a little stunned by the whole thing, and thank God for painkillers. All right.